All right, fall brings cooler temperatures, colorful leaves, at least in other parts of the nation. But for many, fall means allergies. And that can make it hard to know if you're really sick or if you're just stuffy because it's that time of year. Here with more is Liza Bryant with P3 Medical Group. Thank you so much for joining us.
Thank you for having me.
So it is hard because right now you're not sure, is it pollen just making my nose itchy or am I actually sick? It's tough to distinguish.
It is, and symptoms are very similar, sneezing, runny nose, but allergies and upper respiratory, there is quite a difference.
And it's hard for seniors, too, particularly, to distinguish between the two.
Yes, it's very hard because they just don't know what's the difference, and that's why it's very important that we need to follow up on these type of patients.
Yep. So if you have a neighbor or mom or somebody, make sure you check on them. So let's talk about the difference between, cold and flu and allergies. What are we looking at here?
So cold and flu are caused by viruses, and if left untreated, they can progress into something more serious, like a sinus infection, pneumonia, upper respiratory severe infections, bronchitis, and then allergies are caused by pollen, which are typically the itchy, watery eyes and sneezing and runny nose.
And of course, the difference is like the cold and flu, if you're in it more than a week, you're probably in some trouble. But the allergies, they can continue for
months.
As long as the season.
Correct.
All right, so if you're unsure, if you're not sure what you're dealing with, what should we do?
Make an appointment with your healthcare provider.
Gotcha. That's definitely, because you guys can help us. You can do some testing, that kind of thing. Now, you mentioned bronchitis, pneumonia, particularly for seniors. That can be serious, even cause death.
Yes, it can, and that's why it's very important for senior population to come and see their healthcare provider and family members to check on them.
All right, and is there anything that we can do? I mean, I know that, my grandma used to tell me, just drink some water with lemon in it or anything like that. From the doc, I know you're a physician's assistant. What can we do to help prevent, if it is cold and flu? If
it is cold and flu, frequent hand washing, lots of healthy diet food, drink, water, your vitamin C, but most important is the frequent hand washing.
Gotcha, that's definitely for sure. And then the allergies, I mean, what can we really do? I mean, there's some medications, but there's really, I don't know, is there anything else we can do besides staying inside?
No, unfortunately, the best thing to do is talk to your healthcare provider about what medication is best for you.
I gotcha. Now let's talk a little bit about P3 Partners. So I know that you guys talk about having patient-centered care. What does that mean to you?
Patient-centered care means that we focus on the patient. And we are also provider-centered, meaning that providers ultimately, we get to decide on the patient's care, not someone else.
Board of directors somewhere else.
Exactly.
I love that. And that's particularly important, like you said, with seniors, and Medicare open enrollment is coming up, so there's a lot of things going on. I really appreciate it. And I understand that you guys can do things at lower cost sometimes as well, too, or you can work with the patient?
We can work with the patient,
right,
correct.
and help them out as far as all that. So, well, thank you so much for joining us. I appreciate it.
Thank you for having me.
So for more information on P3 Medical Group, you can call 702-333-4700. That's 702-333-4700. Or, of course, you can always go online, click on p3mg.org, and they'll set you up. Thank you so much.